You are watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, facial plastic surgery, what you need to know if you're considering this procedure. With us, we have an expert on the topic, board-certified plastic surgeon, Dr. Nichter. Dr. Nichter, welcome to the program.
Thanks, Randy.
Now, let's talk about, well, first of all, let's talk a little bit about your background and training. And because you've been, I guess you were one of the guys that started the program, the plastic surgery program at USC.
I was one of the early faculty members, the third member, and we grew to 27, the largest in the country. I'm actually triple board certified in a variety of subjects, obviously plastic surgery being the most important. And it's just great to see the wonderful changes that have occurred in my own specialty and what we can offer patients, especially in aesthetic surgery.
All right, so what do you call it? Facial rejuvenation, facial aesthetics, what do you call it?
Facial rejuvenation is the best word because it really means turning you back to way you once were.
All right. Okay, so let's talk about face lifting techniques right now. What seems to be the hot thing? These low downtime facelifts we see on TV. Give me your thoughts on that.
All surgery, and especially facial aesthetic surgery, has moved towards minimally invasive techniques, less incisions, less scars. The problem is there's a number of people that are doing it that may not be as trained, and there's some wonderful principles that if you follow, can get very natural appearing facelifts that last long, long time through minimal incisions.
Okay, so let's start from the top down. What are you doing for the brows and the eyes? Seems like the eyes are the dead giveaway. They seem to get old first.
Oftentimes they do. On the brows, for example, just in terms of a brief history in the last 15 years or so, is we started with these huge incisions across the scalp and lifted things up, and it made people look like deer in the headlights. We've gone away from that completely. We don't do that. We really study what looks natural, and what we found out is oftentimes the inside of the brow looks pretty good, and from about the midpoint on, it takes a dive. Okay. And by doing these little minimal incision brow lifts, for example, we call them temple lifts, behind the hairline where you don't see the scars, it only takes about a half hour or so. You can lift that brow to a more rejuvenated position. You still have animation, facial expression can be shown. You do not have a fake look whatsoever, and it just lifts a little bit off the upper eyelid. And then the eyelid skin, of course, the redundancy can be removed. The big thing between the upper and lower eyelids is we tend to not remove as much fat, but redistribute it.
Are you talking about under the eyes? So bags under the eyes?
Well, both. If you take too much here, you can get a hollow look. It looks great at the beginning, but 10 or 15 years down the line, it can look hollow and cast shadows and have deep set eyes. Underneath here, there's the bag is a bulging fat, but if you can flatten that out, there's actually a depression underneath that causes the shadowing, the dark circles in photos, and you can use that to your advantage. And then, of course, remove the skin if there's any excess, but it's usually less than you think. You get some wonderful looking eyes.
Okay, so what are you doing surgically then for the eyes?
So surgically,
like under the eyes, I guess specifically.
Yeah, so under the eyes in particular is we remove skin that's necessary. You can take the fat and there's a fine little membrane that holds it in place, and you can release it and allow it to drop down to fill in that depression beneath it. Sometimes we'll put even a little bit of filler. It could be your own fat, or it could be a little filler even lower than that, so there's a smooth
What do you like to do?
cheek lid junction. I like to use patient's own fat because you don't have to replace the filler. You don't have to redo it.
Okay, okay.
Yeah, and you get a very natural looking lower lid. That'll last. Usually, there's been very few that I've ever had to redo.
Okay, so moving down the face, what else? What else? Well, in fact, why don't you tell me this? When a patient comes in, let's say a 50-year-old woman, okay? When you look at her, what are you looking for?
That's probably the best question of all. Most importantly is I tell people how they age, and they age in three ways. One is obviously skin sagging and muscle sagging, the soft tissue that sags in your face. That's what all the lifts are about, which we'll spend most of our time with right now. The second thing is volume changes. You lose volume over your cheeks. You tend to gain it over your jowls, some people underneath their chin. And we tried, again, to restore it to where it used to be. And lastly, textural changes. Pores get larger, pigmentation around your skin, things of that sort. And we can smooth things out, get rid of a lot of the fine wrinkles, soften the deeper ones at the same time.
So so in your hands, what's changed when addressing the aging face in your hands over the last 20 years? Why are you getting better results now than you did 10 years ago?
Well, first of all, we listened to our patients. This is what our patients told us.
Okay.
Number one is I don't want to look swept away or that wind tunnel effect. I really want to look natural. I want to look like myself. In fact, here's a picture. This is what I want to look like.
Okay.
Number two is, this whole huge recovery and the telltale signs. I don't want people to know I had a facelift. I don't want scars around my hairline so I can't wear a ponytail. I would like to do it any way I want. I'm not sure I want a general anesthetic. Isn't that scary? Or don't I have choices? Can I just do in your office under just local anesthesia, maybe some oral sedation? And I want a fast recovery. I need to go back to work. And those are the things we hear over and over. And with that information, myself and my associate, Dr. Horowitz, have changed the way we do the procedure. We call it the light lift.
Okay.
And we've been doing this for about the last 12 or 13 years. Let me give you an example of how we do it completely different. Most facelifts are pulled back like this. So if it's overdone, you can get that swept away, and everyone in your audience.
I feel like I could spot a facelift.
Yeah, and everyone
10 yards away.
So can everyone in your audience when they look at TV or a movie. They'll say, wow, look at that guy, for example.
We talked about a guy before we started.
We did.
Yeah.
We're not going to mention that name, but yes, we did. So one of the things we do is we don't redrape the skin backwards because you don't age this way, so bringing back this way doesn't make sense. We do a complete vertical lift, which when you think about it is anti-gravity. It's returning yourself to the way you once look, so you can't look too tight. We rely not on the skin to pull things tight or snug, but the underlying supporting structures of the skin, which also support the muscles, and it's where those stitches are placed that make all the difference. So you have a natural appearing face. Because we don't bring the redundant skin behind the ears, there's no incisions, it just ends behind the earlobe in the crease, inside the ear, and then into the hairline or along the hairline. And so it's 40% less scarring. We do it in the office under local anesthesia with oral sedation. But the big thing is comfort. If they want, twilight sleep with IV sedation or general anesthesia, that's no problem at all.
Okay.
But that allows us to get 40% less scarring, outpatient surgery. It takes us about half the time of traditional facelift, 2 hours rather than 4, for example. Fast recovery, and a very natural appearing face.
What are the age ranges of these patients that are doing this? You call it a what? What type of lift?
A light lift.
Light lift. Mm-hmm. And what are the age ranges?
The age ranges are very interesting. So when I first started, it was people in their 60s. Now we do it people in their 30s. If there's Well, if they need it. For instance, we live in Southern California. There's a lot of premature aging of the face, and it can be adjusted. We adjust everything to what people need. It's not you have a hammer and the whole world's a nail sort of attitude. And it can go into the 80s. I'm more interested in your physiological age and not your chronological age. If you're healthy, you're a great candidate.
Okay, good. We're out of time. I want to thank you for coming on the show. If somebody wants to know more, what do they do? They want to meet with you?
Just go right to my website, give us a call.
Okay, good. Thanks again for coming on the program.
That was a pleasure.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. For now, I wish you good health.